So I got this comment, but I've seen many videos out there of women with pelvic pain who were healed from mind-body techniques. So how do you reconcile that? On this video that I made asking for better diagnostic testing before broadly telling women their pelvic pain is from the brain. And I stated that until we have better protocols and tools, and every patient is getting a workup like they do at a vulvovaginal specialist, which they're not currently, I simply stated that it's harmful to tell someone with a diagnosis of exclusion, garbage pail diagnosis, automatically that their pain must be coming from their brain. So I am going to answer this question, but first I just want to say that that is something you and all your colleagues should agree with. I've read John Sarno, Howard Shubner, Alan Gordon, done the Curable app. The premise of pain reprocessing therapy is that there is no structural, biomedical, physiological pain generator. So how are you going to arrive at that point with medical conditions that are observably understudied, where patients and specialists in the field are telling you they are stigmatized and not being properly treated medically? You can't properly screen someone for neuroplastic pain if they're not being given significant and in-depth differential diagnoses. But to answer your question, I've never said that women can't be healed from chronic pelvic pain conditions with mind-body techniques. In fact, I believe some of them can. Pudendal neuralgia, vulvodynia, interstitial cystitis, a lot of these chronic pain conditions are garbage pail diagnoses. I didn't make up that term. You can look it up. Or diagnosis of exclusion. Then when you see like the few specialists, they will tell you that there are actual causes, many actual physiological causes. Problem is we just don't have enough doctors or enough access to doctors who are capable of doing that specialized care. So for vulvodynia, a chronic pelvic pain condition, we have these different causes, and one of them is hypertonic pelvic floor, which is pelvic floor muscle tension. So I fully believe that if you have any kind of chronic muscle tension, that can cause pain. I agree with John Sarno on that. His original theory was tension myositis syndrome. TMS pain was a myomuscle inflammation from chronic tension holding. And as a person with hypermobility, I have felt that in my own body, and it's true. Now, the difference is that for some people, it is internal emotions and thoughts and feelings that is causing that chronic clenching and spasm and holding that they're maybe not even psychologically aware that they're doing. It's just a habit at this point. That's a very normal response. When I think about like every time I've had the flu, my whole body gets aches and pains. And what do I want to do? Tighten and squeeze and hold. So I totally believe that psychological pain and that's untreated or unacknowledged and unawareness of a body connection could cause a tightening, holding all the time that leads to chronic pain. But I also know that it's not just internal generators that can cause that. Something like hypermobility spectrum disorder, where you are completely like a wet noodle as you go about your life, can cause lots of muscles to recruit to create stability around parts of the body like the pelvis, the neck, shoulders, the hips, the feet, the ankles. And that's a structural cause of chronic muscle tension. And no amount of working on your mind or body is going to change that. And that's just one of many causes of the symptoms that get diagnosed under the umbrella of vulvodynia, many of which have very concrete biomedical causes that also frequently get misdiagnosed. So I do believe that people can be healed with mind-body if they have a root cause of symptoms caused from hypertonic pelvic floor, and if that cause is coming from internal stress and not external factors. But another thing I've seen many times over many years of being in chronic pain support groups is that the people who are saying they were healed by mind-body methods will also say that their doctor diagnosed them with vaginal atrophy and they've been using topical estradiol for 6 months. Okay, that right there is a physiological cure oftentimes for bladder pain and vulvar pain and pelvic pain. Or they'll say, I was doing pelvic PT at the same time as I was doing the Curable app. So the pelvic PT is a structural way of treating this. It's a physical way of treating a physical root cause. Or they'll say that they got a lichen diagnosis and they have been using a topical steroid. But because they're human and we like to credit ourselves and feel like we have more control over things that happen in our bodies than we actually do, I've seen a lot of people not realize that they were treating a direct root physiological cause of their condition simultaneously to addressing it with mind-body psychological causes, and then they prefer to credit their own brain than to acknowledge that they were also treating a root cause. That's just what I've seen. And in those cases, it's really impossible to know how much the central nervous system calming and relaxation techniques and mind-body tools were actually responsible for the healing. It becomes more like a purple hat, if you're familiar with that concept, than an actual cure. Like the purple hat theory is like, I got salmonella, I took antibiotics while wearing a purple hat. The purple hat must have cured me. I see a lot of that, and that is another answer to your question. Another thing I see a lot of, because I've actually been in the Curable Facebook group for years, and I've been on TMS Wiki on the forums there, because I spent several years trying to heal myself through mind-body processes. And what I've come to understand is it is a non-falsifiable belief system. It is a non-falsifiable belief system. So any improvement that a person who experiences in mind-body pain is attributed to the method of mind-body healing, or pain reprocessing therapy, whatever you want to label it. Then, these systems of belief have come up with labels for anything that is not you healing, that still proves the system is working. I've seen the same people for years in these groups with pelvic pain not getting better. A lot of these conditions are also, they flare. A lot of the root causes flare. So when a person is not flaring, they'll say the mind-body treatment is working, and then they'll be flaring and they'll come on and be like, I don't know what's going on. And everyone will tell them, healing isn't linear. Have you ever used that one? Whenever it's like, it's not working, I'm not getting better. Healing isn't linear. You're just facing a plateau. Plateaus are normal. You're just facing inner resistance. It's your inner resistance to healing. You need to do more internal work to discover why. You're just getting stressed again. What's been going on in your life that would cause you stress and cause your tricksy little mind to play up this chronic pain again to distract you from your emotions? Well, we're human and we are always having emotions, and there are always stressful things going on in our lives. There's essentially no way for this system to ever not work, because when it does work, it's the system working. And when it doesn't work, just keep blaming ourselves and our minds and our emotions, or the nonlinear healing, or the resistance, or the plateau. And so a lot of people will tell you that mind-body pain is helping them and helped them. I even had a guy I dated tell me like he was having horrible back pain. It was so bad. It ruined a trip we planned. When I mentioned mind-body pain to him, he's like, oh yeah, it worked for me. I'm like, then why are you unable to get off the couch right now? According to him, it worked. I would call that not working, not addressing the root cause of the pain and continuing to have a chronic back issue. And those are just a few of my arguments. I'm just going to stop now because I think this video is long enough.